Hi, this is Jennifer Albright, and I'd like to introduce the Indiana University Health Colorectal Cancer Initiative. The purpose of the initiative has three components: a public health rationale, corporate mission alignment, and operational excellence. The American Cancer Society estimates that in 2018 there will be over 97,000 new cases of colon cancer, 43,000 new cases of rectal cancer, and over 50,000 deaths from colon cancer in the United States. Indiana ranks 42nd out of 50 for colorectal cancer screenings among those aged 50 and older, with rates lower than the national average in all ages and ethnic classifications. The Department of Health and Human Services Healthy People 2020 initiative has an objective to increase colorectal cancer screening rates up to 70.5% of those ages 50 to 75. And the National Cancer Institute cites several studies showing that fecal occult blood testing has been shown to reduce colorectal cancer mortality by 15 to 33%. And colonoscopy has reduction rates of up to 60 to 70%. This shows huge potential for significant public health benefit. You can see where Indiana ranks fairly low on the list of screening rates. Indiana University Health's mission has several components, including the values that center around quality of care and respect for life, and leadership in health promotion and wellness that would support this initiative. There's opportunities for increased operational excellence through improvement in organizational quality scoring, data analytics to identify at-risk population for preventative outreach, and enhanced care coordination and communication across disciplines. The action plan took in several components. Initially, a focus was on the national quality initiatives that existed for this endeavor. The Centers for Disease Control strategic goals cite healthy people in every stage of life and healthy people in a healthy world. The Department of Health and Human Services strategic goals include to improve the quality of healthcare services through increasing the appropriate use of effective healthcare services by medical providers. And the Department of Health and Human Services Healthy People 2020 initiative also sought to increase the screening rate to 70.5% for those ages 50 to 75, which is over the 2008 baseline rate of 52%. HEDIS and Medicare Stars also reward high preventative care within health plans, which would also augment this effort. Technology initiatives that exist also include that through the Department of Health and Human Services, there is a goal to enable and improve the integration of health and human services information, improve the quality of healthcare services through acceleration of the development and use of an electronic health information infrastructure, and to achieve excellence in management practices through enhancing the use of information technology in service delivery and record keeping. Stakeholders were identified for this process, knowing that several internal stakeholders would need to be involved in this process to maximize its potential and make sure that all components were seeking the right candidates for this procedure. Chief medical officers, the CEO of board trustees, Indiana University Health Plans, the physicians and endoscopy centers, primary care physicians, the data systems technicians, and quality metrics reporting folks would also need to be involved in this. External stakeholders were identified, however, at this point were not involved in the structure of this program. There was a Gantt chart created to show the structure which and the timelines that we would need to do in order to get this started. So as you can see in 2017, some of the scope and structure had been completed, but some of the fine details and implementation, statistics, and goals had not been done yet. So communication to key stakeholders happened by last fall. Initiation of the benchmarks and citation of barriers happened last fall and Q1 of 2018 through a trial outreach initiative. Then in May of this year, baselines will be determined based on those baseline numbers that occurred with the first initiative or outrolling of that contact. And then thereafter, there will be annual reviews of the initiative goals, objectives, and finances to assure that the initiative stays on track. The methods identified for outreach include identification of candidates. There will be EMR data mining for eligibility using current preventative guidelines, age, risk, and history of screening. Also, the EMR will be able to access patients across all care environments within the IU health system, which stretches across the state of Indiana. There will be targeted outreach. The EMR search will be done to see if there's any current screening plan in place for these patients that are identified. If there's no documented plan, outreach will occur. Methods of outreach will be 3 telephonic attempts and a mailer with fit testing cards enclosed encouraging screening at that point if no communication is able to be established prior. And then the communication will be done to the provider via the EMR of any efforts that have been taken. Care coordination then would occur because the patient is flagged within the EMR profile as eligible for screening. So anytime they come into the office or are seen by a provider, that will be able to be quickly noted. The EMR communication components will include outreach efforts, screening scheduling consented, fit testing issued, inability to contact or schedule, barriers to testing consent, and then the primary care provider would be able to request additional contact for scheduling if indicated. The funding for this program, currently a 0.5 FTE medical assistant has been included into the operational budget for 2018, with a focus exclusively on Indiana University Health Plan participants only at this point as an initial rollout, and the anticipated increase in colonoscopy and laboratory revenues will be used to offset that salary. The goal, however, for 2019 and 2020 would be increase that role to 1.0 FTE medical assistant to allow for expansion to additional health plans. And then there would need to be a break-even analysis to determine screening needs to absorb the program costs, because the ultimate goal is for this to be a 100% self-funded initiative. The goals of the program are to improve quality of care and access to preventative screening, accurately identify patients eligible for preventive care services, and to facilitate identification and resolution of gaps in preventative care across disciplines. Those objectives would be quality metrics targeted towards screening, colorectal cancer screening rate improvement, aspiring to meet national goal of 70.5% among those aged 50 to 75, accuracy in identification of potential candidates by identifying 100% of eligible screening candidates, and revenue generation adequate to sustain programming, making this a 100% self-funded initiative. An effective communication tool would need to be established as well, showing a cross-disciplinary communication system to increase awareness of members eligible for preventive screening exams, communication and documentation of contact, education, and scheduling procedures, and to encourage collaboration across all care environments. There would also need to be a data analytics tool developed to effectively identify patients based on clinical indicators for population health outreach accurately, efficiently, that would be scalable and replicable. Additionally, there would be an opportunity assessment which would be ongoing, showing barriers to screening, maybe fear of test, fear of prep, cost, transportation, denial of possible health issues, service issues, possibly education or others. And then an action plan development for barriers would be identified if there's a greater than 25% frequently cited reason for this test to be avoided. Evaluation criteria. How are we going to know if we're successful in this initiative? There's been a key performance indicator card developed that will track success. Keeping in mind the IU Health mission goals of leadership in health promotion and wellness and quality of care and respect for life, with the strategic goals fueling these metrics being improving the quality of care and access to preventive screening, accurately identifying patients eligible for preventive care services, and to facilitate identification and resolution of gaps in preventative care across disciplines. There's a baseline number that has been indicated for the measures that were possible, and then target figures were calculated based on the national quality initiatives that are set forth. So our patient contact rate was 68%, with a target hopefully of 95% or greater. Colonoscopy consent rates and completion rates are listed, hoping that since consent rates for colonoscopy are so low that we could at least get to 50%, and the completion rate would be the same as the Healthy People 2020 goal. Fit testing rate was higher, However, you notice the completion rate is quite a bit lower currently. So consent rate obviously would want to be higher, but we would also want that completion rate to be aligned with the Healthy People 2020 initiative goal. And then an overall look at all patients across the entire plan, not just those that are currently targeted or eligible, to also be at 70.5% overall. And then data accuracy, we want to make sure that the data tool we're pulling is not pulling a lot of extraneous numbers that do not apply. So we want to see 100% accuracy on that ideally. And the bottom, we are looking at funding. So the total program costs have entries into the budgeted amounts for 2018, 19, and 20, and with a goal of doing an analysis each year of how much of that program can be funded, with the goal of it being 100% funded through revenues created from the program initiative. Indiana University Health seeks to become a model for quality care delivery within the Indiana healthcare markets, seeks to become a leader in preventative health and wellness initiatives, and seeks to achieve national preventative health screening goals. The Colorectal Cancer Initiative is an example of their commitment to such efforts. Thank you for your time.